Hello, big team. This is Vincent Obita, and today we are going to continue the session of care plan of a post-op patient. This was also a request by one of you in the comment section. Now, last time we covered the aspect of pain for the same patient. Now, today we are going to cover the aspect of risk of infection for a patient who has had an operation. Now, these are risks, and for the risks, you can't evidence them because there's nothing occurring as per now to determine their detrimental effect on someone's health. But you want to put like measures to prevent these risks from occurring. Now, we'll use still Daisy as our example in this case. And for the care plan, using the nursing new test of competency for OSCE, that was reviewed previously in November. It has 4 elements. That's the aspect of nursing problem, aim of care, reevaluation date, and care provided by nurses. Now, under nursing problem, I will just state that Daisy is at risk of infection due to surgical intervention following hernia repair. Now, under the aim of care, unlike other aims of care, this aim of care can't be measurable because it's a risk. Now, I'll just state Daisy will have a reduced risk of infection following nursing intervention. Yeah. Then under evaluation date, this one is specific to post-op patients because you will have to observe the timings and the policy of post-operative observation. Now, under reevaluation date, I'll just state to be reevaluated today, yeah, every 15 minutes for the first 1 hour, every 30 minutes for the next 1 hour, and hourly for the next 4 hours or more frequently if the condition changes. That one is specific to post-op patients. You have to write that statement, unfortunately, just the same way I'm presenting it. Then now you shift to the care provided by nurses. Now, the care provided by nurses, you will just still use mnemonic hemataric. Under E, you will just state explain and discuss Daisy's care and gain consent. Then your second point will be monitor and record Daisy's vital signs every 15 minutes for the first 1 hour, every 30 minutes for the next 1 hour, and hourly for the next 4 hours as per the post-operative observation policy. And that statement ends there. They almost look similar with the reevaluation aspect. So know the difference and ensure they appear that way. And this is what makes this care plan a little bit longer compared to the others. So you need to be writing very quickly. Now, the third point under A will be administer prescribed medications and check their effectiveness. You don't need to worry about whether to state the specific aspect of antibiotics or whatever. Just state administer prescribed medication and check their effectiveness. Your next point, which is the fourth point, but the first point specific to risk of infection, will be dress Daisy's wound as prescribed using aseptic non-touch technique to reduce the risk of infection. One aspect you need to know by this time is that every element you give a rationale, okay? And also, or just support it with an aspect. So if I state dress Daisy's wound using aseptic non-touch technique to reduce the risk of infection, then the next element will be teach Daisy on elements of personal hygiene to reduce the risk of infection. This now related to how they grooming and all that, just to ensure this wound is kept clean throughout. This could be things like hand hygiene and things of that kind. Your third point, which is specific to this, will be under referral. And where will we refer Daisy? We'll refer Daisy to the infection prevention and control nurse for further intervention and guidance. You can realize that we are giving rationale for every element. Then now we get back to the aspect of instructing Daisy on proper use of call bell and placing it within reach and documenting all cares as planned. If you have more time, you can add another point, which is assess Daisy's wound for signs of infection, such as bleeding, maybe content of pus, or any smell. And that would work for you again on additional point. So that one covers all the elements that you need to cover for this bit of the care plan, and with that one, can assure you all will go well and you will click that on your OSCE. Just the elements that you need to know: one, you can't put any evidence based for the risk. Then take care of the two sentences. That's one, the reevaluation date, the aspect of 15 minutes, 30 minutes every 1 hour, and hourly for the next 4 hours, which appears under the reevaluation date and also appears under the monitoring aspect. When you cover all those, you will be okay to go. Thank you so much. Continue subscribing. If you have any questions or an area that you want me to cover on your behalf, then just drop it in the comment section and I will sort you out. Thank you so much, and I wish you all the best as you undertake your OSCE. Bye for now. Thank you.